All right, looks like we live. Welcome everyone to Plant-Based Homestead Prepper. Well, we make prepping fun. That's our tag phrase. Anyway, I am so excited. Not under these circumstances and situation, but I am excited to have my best friend on live with us tonight, and none other than Mr. Ferell D. Johnson. What's up, brother?
Hey, what's up, man?
How you doing?
I'm doing good. Despite the situation, doing good.
Yeah, despite the situation, I was hoping that I spelled it right, didn't I?
2 R's, bro. We know each other 20 years.
Yeah, 30.
30 years.
Ferr. I don't know why I always want to put one R in it. There it is.
Yeah.
Bam. Ferell.
Thank
Ferell
you, Brother Rick.
Johnson. Yes, thank you so much, Ferell. So man, I know I never thought I'd see the day we'd be having this conversation. Honestly, I've been prepping for this kind of stuff and thinking things like this could happen. But I never thought I'd see it in our lifetime. I never thought I'd see it. Did I lose you?
No, can you still hear me?
Oh, okay, yeah, there you go. Dang, bro. I mean, we've been talking about stuff like this. We've been talking about buying land, getting the spot, living off the grid, and we too late now.
Too late.
It's too late. We messed around and waited too doggone late. All right, say something again.
Yeah.
Make sure I can hear you.
I said it's too late to get off.
Oh yeah, it's too late. It's too late. It's oh my goodness, it is what it is at this point in time. We're gonna have to try to figure something out. But anyway, go ahead and introduce yourself, man. Tell us what you do for a living, how long you've been doing it. And I wanted to bring you on, from your expertise. And it's kind of funny that because we joke each other all the time. We've been knowing each other. Golly, we met in high school, so that was what, my freshman year. That was 1988. I mean 89.
Yeah.
No, that was 1988. Yeah, that was 88.
Yeah, it was 88. Yeah, so it's been a while.
18. Man, we've been knowing each other We've been knowing each other 32 years.
Yes, sir.
We've been knowing each other a long time. We have talked about a whole bunch of things in our lifetimes, but I never thought we'd be talking about. Go ahead, man. Take it away. Let us know who you are, what you've done, what your background is, and then that'll kind of guide our. I didn't even write no notes because I know we can sit and just talk forever. So I didn't even write any notes.
Right. Down. Well, my name is Ferell Johnson. I'm a MLT, which is a medical laboratory technician. Went to school for that in the military. I was a medic first. Then I went to MLT school, and I currently work for a company, Clinical Pathology Associates. We contract, UT contracts us to do their lab work in.
Now, for those that don't know, let us know what UT is.
University of Texas Medical Center in Tyler.
Right. So that's a huge name behind. He's not working for a fly by night Roderick's testing center. Joe's Crab Shack, and then we test and do blood too. No, he's working for the University of Texas Health Center there in Tyler, Texas.
Yes, sir. Used to work for LabCorp in Atlanta. Yeah. In the military, got to see a lot of things, a lot of mind-blowing things. Even in Atlanta, I don't even know if I told you, Roger, but in Atlanta, while I was working, because I worked at Wellstar Hospital also.
Okay.
And we were there doing the Ebola. And
I remember we was talking. Yeah, we talked about that when you was doing that.
Yeah, we contracted with them. I was pulled to go to Emory to help out with the Ebola patients. So
okay.
I had the unfortunate pleasure even to see that outbreak firsthand, which was nothing like this. And honestly, this is one of the scariest things I've ever seen as far as in the pathology world. It's really scary.
All right. Well, since you mentioned it, yesterday I'm gonna cover these numbers and then we'll talk about the numbers currently. As of yesterday at 7 p.m. my time, which was 6 Central, we had 661,367 cases worldwide, with 30,671 deaths and 141,464 had recovered. As of tonight, right now, I'm gonna read out the live numbers worldwide, and I'm getting these stats from coronavirus update. Okay, so they might not be the most current. They might, these are not the CDC stats, but it's the one I pull up every day and look at if it will work. Apparently, I don't want to act right now. Okay, here we go. Bam, coronavirus, and also we're gonna talk about. I don't know if you heard yet, but the president has declared we're gonna do this social distancing up until April the 30th. So I guess his prediction of us going to church on Easter Sunday is not happening. Which you and I had talked about that. We already knew that was not gonna happen. I can't see the full of the numbers right now. But had you heard that? Had you heard that message from the president?
Yes, sir. I was actually listening to it before I got on the broadcast. Listening to a lot of it.
All right. So I asked the same thing I asked Michelle last night. What? Now you're working because I know. Well, I don't know because the last time we talked about work, you were doing stuff for dialysis patients.
Yes.
And now you're doing some actual testing. Is that accurate?
I actually collect the samples
Okay.
for the testing. At the center I work at, the clinic I work at, is one of the 3 clinics that does the testing. Well, collects the samples for the testing in the Texas area, in the Tyler area. If someone feels they need to have a test, my center is one of the centers they go to. So I was right there from the beginning, seeing the patients come in.
Right. And we've been talking off and on about this thing, back since probably in January when I first started calling you and talking to you about it. And I was like, man, you know about this corona? You was like, yeah, it ain't nothing to be played with. And that was way back in January, and that was when we really weren't even in the United States yet. We were just talking back and forth about what was going on overseas and hoping that it wouldn't come to our country. And unfortunately, here it is, and it's raising its head and not looking down. So, how many patients prior to this outbreak? I asked you the same question I asked Michelle last night. How many patients were you seeing on a day-to-day basis or week-to-week basis prior to the outbreak?
In my clinic, the lab I work at, we service 10 different doctors, anywhere from internal medicine to pediatrics, to various disciplines.
Okay.
And we could see anywhere from 100 to 150 patients a day.
Wow. I didn't know your work. I didn't know y'all was doing that. So how many of y'all seen since the outbreak? How many of y'all seen?
It's amazing the dramatic drop off. I think.
Wait a minute, you said 100, 150 a day?
A day.
Oh wow! When you said day, I heard week. So 100 to 150, and that's 10 doctors, and you guys are running labs for all 10 doctors.
Right.
Okay, so right now, March whatever week this is, the 3rd week of March. How many of y'all seeing daily and weekly now?
Probably about 30 or 40.
Wow! So it's going down. Not even
much. It's Friday. I think we saw maybe 25 patients.
Oh wow! Is it that people just don't want to come see the doctor? Is that what it is? They scared to come see the doctor?
It's a combination of people not wanting to go see the doctor, but UT has been at the forefront of making really, I think, sound decisions. They made a decision since we were going to be a hot spot. They cut out all non-essential doctor visits, like for checkups and physicals and headaches, and all there is telemedicine. Doing
teleappointments. Right. Okay.
Yeah. And so that's why the only reason you're coming into the doctor, into my clinic now, is if you were suspected of COVID-19, or if you were needing direly to see the doctor for medication purposes, or to check your. We have a lot of people that on blood thinners, medication.
COVID-19 or Yeah, I'm paying attention to you, bro. I'm checking, making sure we live. We good to go on the other sites and platforms. That's
Yeah.
crazy, man. So y'all went from 100, 150 a day down to as low as 25 on a Friday. So is Friday normally y'all's light day by purpose, or
No,
is that's just not normal?
no, it's not normal.
Oh wow.
Not normal at all.
Wow, wow. Okay, so now, I know we've been talking, and of course, I want you to keep all patient confidentiality and stay with the HIPAA law and all that kind of stuff. But off and on, we've been talking, and you have actually seen people come in, be tested, and you have kind of developed looking at them and seeing their stuff, knowing yay or nay if they probably have corona.
Yes. And that's not definite. It's just
Right.
we're seeing so many people that you can really tell if it's corona is not an upper respiratory virus.
Hmm.
You're not going to have a runny nose and sneezing. You know, so a lot of people are coming in thinking, "Hey, I need to be tested because I have these symptoms."
Right.
But you can tell, right? The doctors, and it's amazing how difficult it is for these patients to get tested. You know,
Even though
not
we're
only
hearing one thing on a national platform, if you want to get tested, you can go get tested. It's not that simple.
no, it's
Okay.
not. It's not. I remember I was talking to you about it was 2 weeks ago,
Right. Right.
uh, or 2.5 weeks ago. We had patients coming in. No, it was actually 3 weeks ago. We had patients coming in 3 weeks ago wanting to be tested.
Right.
We had no test.
Right. Exactly. I
No
remember.
test.
Yeah, we did talk about that. Yeah.
Like people coming in, we don't have no test. Doctors didn't even know how to order it. They would bring me samples like, what I'm supposed to do with this? I'm like, I don't know. you know, we don't have any tests.
Right.
So then uh, came, and I wish I had the dates. I should have wrote down the dates. Uh, After that first week, that second week, 2 weeks ago,
Hmm.
they said
So this is roughly
we got
latter part of February, first part of March. What we're talking about right now.
yeah, we
Okay.
got 50 tests,
Okay.
50 tests for all of the
The area.
entire.
And how many people? Because you're talking about Smith County. Y'all do all the testing for Smith County, not just Tyler, but Smith County, right?
Well, the test didn't come to us. The
Okay.
test came to health department, the health department for Smith County. So
Okay.
the health department for Smith County got 50 tests.
Wow. And you talking about what's that? 3, 4, maybe 500,000 people? If I mean,
Yeah,
is it that many? I know Tyler alone has 80 to
yeah,
100,000. Then you talking about the whole county. I mean, you're talking about a lot of
yeah,
people.
yeah. It was dire, and doctors were put in a position where they had to pick and choose.
Right.
Who got the
They
test.
had I had to almost do a triage situation.
Right.
Okay.
And a lot of people I know, I think with most certainty, probably were positive, were not tested because they didn't meet the guidelines set out by the federal government who gave out these
And three
tests.
now, do you remember 3, 4 weeks ago? What were the guidelines then to be tested? Have they changed since then or what?
Guidelines have not changed.
Okay.
Guidelines are still you have to be in contact with a known person who's positive overseas, uh, in one of the hot spots. Or well, they have changed in one of the hot spots in the United States now. You have to be
Okay. So hold
either
on. 3, 4 weeks. Cause that's why I asked it. Cause I know they've changed. Cause 3 or 4 weeks ago we were talking. You had to be coming in from a hot spot overseas. So
now it's the hot spots in the United States, such
so
as New
Washington
York,
State, New York, California, Georgia,
Louisiana
maybe.
now,
Okay, Louisiana there. Okay.
and Georgia.
Wow.
Yeah.
Okay. Hmm. So things have changed. All right. So I remember when you called me, you like, man, we got our first case, and
Mm-hmm.
it was a gentleman. I think you told me he had been traveling. We're not gonna tell him what his occupation was, but he had been traveling, and he came back and he had it. And what happened with it? I know he had to go to quarantine.
We went to quarantine. He was sent home. Went to
Okay.
quarantine. Yes.
So you guys are just sending folks home, be like, hey, you got it. Go to quarantine, which is home, and we trusting
Mm-hmm.
people to stay at home.
Yep. They're keeping in contact with them, getting their information,
Right.
make sure the symptoms don't change. but the risk to transmit it is too high.
How often are you guys? Well, I'm sure you're not calling them, but how often are they calling, checking up on these patients or clients or whatever y'all call them? What do y'all call them? Patients?
The patients, yeah,
Okay.
yeah, they're called multiple times a day. They're
Oh,
called
really?
multiple times a day. Yeah.
Okay. Wow. I was thinking to be one time a day, so they call it. Okay. So when they go home to quarantine, are they told to check their temperatures or log their coughing or something? What if you get and you go into quarantine? What are you supposed to do to track your medical history? I guess.
Well, they take the temperatures, they monitor symptoms. If symptoms get any change in the symptoms, they're to call. If they get better or they get worse, they're to call.
Oh, really? Okay. Even if they get better,
Yeah,
I guess that makes sense because they're trying to collect data.
right.
Okay. So since that first case, 'cause that case tested, because you actually saw, did you actually see that case come in?
I saw that case come in, um, sent the test out, and within I think it was 24 hours, a little over 24 hours, it came back positive.
Okay. Now, are you the one actually doing the test? And tell us what the test is like.
I'm not the one doing the test,
Okay.
uh, but I do understand the testing method. Right now they're using a PCR test, which to cut through all the mumbo jumbo, they collect a little bit of the DNA from the inside the nose or deep throat. The which is RNA because this is from a virus. They put it in the solution, which multiplies this RNA. The the RNA sequence is multiplied enough until they can look and see this is the sequencing for this COVID-19 virus, and then it's a positive. That takes a while for the replication process to take.
Okay.
That's why it takes
Gotcha.
so long.
Okay. And you were telling me that before you guys could pretty much, y'all were doing the test there, and then y'all were getting the results. Or
We were we were
can you even go into that, or is that like top secret or something?
no. It's just not well known, but I'm not divulging anything that's not
Okay. Right.
open. We were collecting the tests. We were sending them. At first, we were sending them to the health department, which is authorizing the kids to be. They'll look over the data, even though the doctor ordered it. They would still check because you wrote down a whole history and why the doctor felt this patient needed the test, and then they double checked it. And if they thought it warranted being tested, they would test it.
Let me ask you this: how now you say that when you say the health department, are you talking about the local health department there in Smith County? And if so, where's that located? Or are you talking about like in Austin?
Um, I think it went all the way to Austin. The local Smith County office got the information. They relayed
Okay.
it to Austin. Austin gave authorization to test, and they got their guidelines from the CDC.
Ah, okay, okay. So pretty much, it sound like to me a bunch of red tape in order to even if the doctor say you need a test, I think you may have it. You gotta take the sample and then send it in and hope they'll approve the test, or do they?
Right.
So okay. So let's say I come in, I got a cough, I got a fever. I say I think I got it. The doctor confirms, yeah, you may have it. I'm pretty sure you do. They'll take the sample then and then
Mm-hmm.
let you leave and then send the test off, and then the local CDC has to get approval from the state CDC to actually test that sample, and then it takes 12, 15, 18 hours to get the test results back.
Right.
So how
They were
long how long is
actually.
that process? Like I come in with a cough and a fever, and my doctor say yes. How long of a process does that whole thing take?
It could take anywhere from 4 to 6 hours. They only test all in Smith County. I don't know how they do it anywhere else, but they were only testing the samples one time a day at 12 o'clock noon. They would test the samples. So if it was collected yesterday at 12 o'clock noon, they didn't test it till the next day. They only test it one time a day. That's because the machine.
Okay, I was hoping you
Right, right.
explain it. I'm like, why? Okay.
It's not. They have a machine that has, and I don't know if they usually go 6 or they have 6 slots or 24 slots. I haven't seen their machine
Okay.
personally, but this is how the PCR testing is done, and it's called batching. You get enough samples,
Right.
and then you run a batch of them.
Okay.
So it's inefficient and too cost effective. It's a waste of the materials if you just do one at a time.
Okay. I see what you're saying. And of course, we're trying to do everything as efficient as cost effective as possible. So I mean, okay, that makes sense to me. But I can come in with a cough and a fever. It could take. Okay, so as the patient comes in with the cough and the fever, how long for that person are they in front of the doctor with you guys before they're released to go into quarantine, or even are they told to go into quarantine at that time?
Doctor typically tells them to go to quarantine right away.
Okay.
After swab is done, go home, go to quarantine, and wait your test results.
Okay. So what if the doctor thinks I may have it and my test is disapproved for testing? Then what?
That was a big issue, because the federal government is right now paying for all tests that they deem worthy of being tested. We
Okay.
collect a sample. If they didn't think it was worthy of being tested, the sample just sat there.
Wow.
We just recently the government just authorized the private sector to start testing these
Okay.
samples. So if the government didn't think they warranted a valuable test, then they're now sent to a private lab like CPL, the one I work for,
Okay.
LabCorp, Quest. They're the three big companies that are doing it. They're doing the testing right now, and those companies go ahead and do the test, regardless if they meets the guidelines. They go ahead and do the test,
Okay.
and then they submit it to your insurance agency, to the insurance company.
And how much is the test? If you got to pay out of pocket for a test, how much are you seeing the test go for?
Almost 300. Right at three, right in the upper 290s range.
Yeah, I remember you
Now,
told me that.
depending on your insurance, you might just have to pay copay.
Okay.
Or they might not cover it. I haven't seen the billing side of it, so I don't know how it's working
Right.
out.
Okay. All right. So let's catch up on some chat. We got a bunch of folks that came in and they're chatting. So I always do a roll call. I normally do that first, but I want to jump right into the meat of the discussion. All right. So we got Mana B2 here. They say please stop panic buying stuff. Got my friend Knife Collector. We call him Dr. Knife. My mother-in-law's in. Hey, mother-in-law. Linda Bishop is here. Let's see who else. Rashante Thompson. Hello, welcome. We got Tara from Homestead Hopeful. Welcome, welcome. Christina. Let me see here. Who would have thought that I had not touched you with a 10-foot pole would become a national policy? Oh, good. Yeah, Tara, tell us about how your fever's doing. Christina, I'm feeling very great, Linda. My kids are also doing perfect. Okay, good, good. Kev H is in the house. What's up, Kev H? And Jennifer's in. I see her. All right, so if you guys got any questions for Ferell, make sure you type them in. I'm gonna try to get to them as they come in. And okay, I got a question from Facebook. One of our Tasha says, and do people have to pay before they can get tested? Good question. So, and that's kind of where we are now. If you come in, you think you got it, your doctor's going to, either make a decision. Yeah, you got allergies, or you may have COVID, and then what happens, Ferell?
If the doctor warrants giving you a test, you're tested at no upfront charge, because they don't know if it's going to be approved by the government, or they're going to have to forward it to a private sector lab, which will then either absorb the cost or send it to your insurance. And like I said, I don't know.
Right.
I haven't seen that back end of it yet.
All right. My mama said, "Hey, riding Ferell." Oh goodness. All right, cool, man. This is real good right here. So let's kind of shift a little bit. I was still trying to pull those numbers up. I'll get them in a minute. The current matter of fact, I'm sitting in front of a computer. Lord have mercy. What in the world, boy? I tell you, the mind is a terrible thing to waste. Ain't current COVID numbers. I'm just gonna type that in and see what we come up with. Okay, Farrell. So right now it's telling me the first site that I came up to, which is Worldometer, and it's saying that we have 721,412 cases, 33,956 deaths, and 151,004 recovered. Now that's worldwide. In the United States alone, I'm gonna read this line. The United States right now, we always got to be number one in everything. The United States right now is leading the world with 141,854 cases. Good gracious, which as of last night, it was 661,000, and now we're at 721. And it looks like that we have new cases plus 58,285 total. I'm sorry, plus 18,276. Total deaths right now in the United States is 2,475. We went up 255 deaths today or in the last 24 hours. Total recovery is 4,435. Active cases 134,944. They got another category that says critical or crucial is 2,970. And then the top cases per, I guess, is 1 million population is 429. I don't really understand that one. Maybe you can explain that one. But anyway, man, it seems like even with all this social distancing that everybody's trying to do, it seems like the numbers are constantly going up. Can you tell us why that may be?
This is amazing virus. One of the things that makes it so amazing is that uh, it is communicable even though you're asymptomatic. And not only is it communicable, it can lie dormant from they're thinking 5 to 14 days.
So in other words,
So
I could have it, not know it, not be showing any kind of symptoms. Don't have a headache, don't have a fever, don't have a running nose, don't have a tummy ache, don't have nothing. For 5
right,
to 14 days, be carrying it around, spreading it, and not even know it. That what you telling us?
right. And it's really 5 to 12 days. That's why they
Okay.
say quarantine to 14. Um, One of the things that makes this, they've come out. We've had SARS, we've had other novel viruses
Right.
that have made that jump from animal to human transmission. That happens before. What
And
makes
and,
this
and let me,
unique?
hold on, for people that don't know, because I had to look this up. What novel means is it's normally in animals. It's not normally in humans. Am I right, Farrell?
Right,
All right. So when they say novel, when they put the word novel in front of something, that means is that human beings are not supposed to have it. In layman's
right.
terms. Okay. So go ahead, brother.
So this has happened before, and it will happen again.
Yeah.
Um, but what makes this so unique is that the rate that it's mutating. Every time a virus duplicates itself, there's an opportunity for it to change its RNA structure and therefore change the way it behaves inside its host.
Okay.
Now, this virus changed its structure when it was in the bat or a snake. They haven't really decided where it came from. They think it's
Right.
bats. They think it's snakes. It changed. It replicated, changed its RNA structure, and was able to be transmitted to humans. So that's one mutation. Now it is already mutated again, and we currently have two strains going around. There's
Right.
a strain L and a strain S. Uh, this is within a matter of 6 months. That doesn't happen. Things don't mutate that fast. So
Okay.
that's why they're just like, this is a new virus. We've never seen this happen before. Um, Also, there are new symptoms coming out which hint around to there being a new, mutation other than the second one I spoke of.
Wow.
They've come out and said that we had a patient just last week had no symptoms, the known symptoms, no coughing, no fever, no uh, shortness of breath. Those are the common symptoms. All she had was diarrhea.
Wow.
But but because she kept coming, they couldn't figure out what was going on. They did test her, and she turned out to be positive. So we don't know what this thing is doing.
Right. Then that's why it's so dangerous. And people that are like, oh, this is this ain't as bad as the flu, and this is this ain't really nothing to be worried about. The reason why it's so dangerous is because it in my research, which is in my study, which is very limited in the medical profession and career, I have learned that viruses, the whole point of the virus is to find a host so it can stay alive. Correct. And when you get a virus that's so elegant that it keeps changing to the point, because that's almost unheard of for the jump from animal to human and then mutate that fast, correct?
Right.
And then now for it be a possible another mutation, for me as a layman, that sounds like that just means that we are that much further from a cure or even a slowdown. Am I right in that assumption?
Right. Now
Okay.
understand, there's a lot of talk with different doctors, but if you notice, they've never said anything about a cure.
Right.
There's not going to be a cure for this. There's only one novel virus that has ever been eradicated, and that was smallpox.
Okay.
No other virus um, has done that. It has been We've been able to do that. That was
Wow.
so this is going to be here with us. The only prayer is we get a vaccine that
Okay.
controls it, like we control measles, and
Okay.
still we have measles out, you know, but it's going to be here for a while.
Wow. Okay. All right. Let's catch up on some chat. Let's see here. When Okay. On average, deaths are about 45% of recovered. If it stays this rate, we can expect 63,000 deaths from those currently affected in the United States. And he put that as a question mark. Uh, in the guidelines, they say you have to come into contact with somebody with the virus, but how can you know if you have been in contact with someone with the virus if that information is doctor/client? What happens after 14 days if you have it when your symptoms are all gone? Does it ever leave the body? Great question. Do you know that? Do you know that answer, Farrell?
It
Once you
does.
got once you got it, you always got it, or once you got it and you done with the incubation period, you're good.
If it's a novel virus, so that we don't know, but we suspect that it does leave trace antibodies, and that's
Okay.
one of the things they're using now to make antibody serum from it from people who've recovered. That's one of the things they're trying right now, but we just don't know.
Okay. Gotcha. Let me see here and check out people. Okay. The virus will affect everyone differently. That's a good comment. Thursday at an assisted living facility in College Station, Texas, a man in his 80s came down with the virus and died Saturday. So explain to us, Farrah, why it seems to attack the elderly more than younger folks. And in addition to that question, I think that because younger people see what's going on, they think they're invincible. And you got a personal story that you can tell us about that that non-invincibility with somebody that you personally know.
Yes. Well, I'll go ahead and tackle the first question first. Um, Again, these are just uh, theories that are going around because we don't know. We do think it attacks the elderly, particularly because this is a lower respiratory virus. It resides when it comes in your body. There's a lot of things going around. I saw on the internet by it's in your throat. You can gargle and you can get rid of it if you get to it fast enough. That's not true. This is a lower respiratory virus. It goes to
Okay.
the bottom of your lungs and it sits there and it just makes a home. Now, elderly people, uh, the theory that I heard that they typically, you know, don't take a lot of deep breaths, not a clearing breaths. As you're younger, you're breathing deeply, you're running, you're more active.
Right.
Elderly aren't, and that goes to say that also people with underlying conditions are susceptible to it because they're already with a weakened immune system, they're immunocompromised. So it being in the lower part of their lungs, it just sits there and just wreaks havoc. I mean, when I tell you it wreaks havoc, it wreaks havoc.
Okay. So talk to us a little bit about your personal story with with these young folks, because we talked last week sometime. You was like, man, I just had to get in my daughter's behind, and I of course I know her. not gonna call her out because she might be watching, but she know who she is. And you
Probably.
like, man, I was so mad at her. Blah blah blah. Explain to the audience what happened last week, and then bring us up to date of what happened this week.
Yeah, my daughter, which is and she has heard it from me, and she heard it from other parts of the family. She's currently staying with my parents, and my parents both have underlying health conditions. Now, they were doing everything they're supposed to do because they believe the hype, and they were staying at home, doing what they can, self isolating. My
Right,
daughter's still going to work, still going to boyfriend's house, still going to here, still going there,
living her best life.
and they're living the best life, and being 24 years old.
Yeah, being 24.
So she came to a person, I won't say who, but came into a contact with a person who was positive. So we had to go through that drama. Luckily, she came back. She doesn't have the virus, but it was tense there because with her being in the house with my parents, uh, Dr. Fauci has famously said that for a person over 60, over 65, this is the angel of death.
Right,
You get that and you have an underlying condition, pretty it's pretty good chance you're not going to make it through. And
right.
that's a I believe a correct assessment, you know.
I got a question. Let's see here. Why haven't they tried to fuse a young person's immune system to adapt to an older person's immune system, kind of like what they do with fruit trees? Okay, good question.
It it would be nice, and that's been tried and it's called T cell transplants. They've tried that with other diseases, and it's a way to go. It's just a long process. T cell research is just not there yet. It's
Okay,
just the disease came before we had that level to use the T cell transplants and stuff.
okay,
Also, the main source of T cells is from uh, fetuses, aborted fetuses. So of course, nobody wants to travel down that road.
right. Okay, great question. All right, well, man, how is everything back home? Because I've been talking to my mom pretty much daily, and she's saying she let me know that Tyler right now is like on lockdown. If you don't have to go out, they don't want you out, and then they implemented a curfew. I guess the other night, and 3 people got cited, and it's $1,000 fine.
Right, right, right. I've heard that. I wasn't out, so I didn't see nothing. I've been going to
Man,
work at home.
so what are they
Last
telling y'all? What are they telling y'all back home? What is the mandate? What's the standard? What are they saying? To do and not to do, and if you get caught, then this is what's gonna happen. What are they saying?
well, basically they uh, have a very strong urging to stay in home. If you don't need to get out, don't get out. Just shelter in place, as they've been saying. And the curfew starts at midnight, and I believe to 6 a.m. So if you're out at that time and you don't have a letter, which you're essential personnel, then apparently you'll get pulled over, you'll get fined. I don't know. I think that's what I've heard. I haven't read
Okay,
anything about it, but that's what I've heard.
all right. Well, I know. Me and you, we both love to eat. So how you been making it? Not being able to go get your water burger or go get some fries. Cause you sent me a funny text up there. You like remember back in the day when you go sit at a restaurant? I was like, yeah, like 3 weeks ago.
Right? It, it's amazing how this has changed the way we socialize
Right,
and how we do things. I make sure that I have the food I need. I'm food prepping. I'm making sure I got breakfast, lunch, and dinner planned out ahead of time. Which before, if I didn't think it out, I knew I could go someplace and just run and
right,
get it. But right now, you're so cautious.
hmm,
The drive-throughs are still open. You can't go into restaurants,
right.
but I don't know about anybody else, but I'm not trusting the drive-through because those 19
I
year
don't trust
olds,
them when it was good.
right?
I, I don't trust 19 and 20, 21-year-old kids cooking my food and make sure it's good anyway on a regular basis.
No,
All
I
right, so
know
we
more people work at those, but that's
right.
just typically you don't. I want to see my food being made. So
Exactly. All right, so we got a good question here. It says, if this is going to be around for a long time, when this dies out enough, so people are not told to stay home. Will there be a new rash of infections for those who are quarantined?
That's what it seems like. Where
Right.
everybody has their eye on China right now, because China is the epicenter, the original epicenter. Everybody says New York is now, but China's the original epicenter, and they've
Right.
just released the their quarantine measures. They're slowly going back. So we're trying to hold our breath and watching to see, what happens if their numbers start going back up. Hopefully, we can trust what they report.
Yeah. Hopefully.
but
Hopefully.
but it's just, I can't emphasize enough how amazing this virus is, and how it. I don't want to seem like I'm praising it, but it's just, this thing is very communicable. You know, it's easy to get. It is slippery.
Uh-huh.
We don't even know that people are, and this is the question that our doctors have been asking other experts, and we've been talking about it at our clinic. We don't even know that once let's say you get COVID-19, you have mild symptoms, or you get through those symptoms, you don't have a fever anymore. We don't even know if you're still able to pass it on
Wow.
after you're so-called finished with it. After it runs your course and your immune system beats it.
Mhm.
We don't know for sure that it's not still communicable.
All right. So I got a couple comments and a couple questions. Let's see here. One question was, are you saying if insurance does not pay, you cannot be treated for the virus?
Um,
Is there even a treatment right now? What's the treatment?
they do have treatments. Pretty much, they're just like you try to slow down the rate of infection. You try to, and I'm not privy to that. I'm not a
Okay.
doctor.
Right.
So there are treatments that they're doing, but there's all like just flu-like treatments. You know, just like you would be treated if you had the flu. But
Okay.
there's no medicine that's really working on it.
Gotcha. All right. And let me see. We got a comment. In our cases, in our area, the cases are have most. Okay. This person said in our area, the cases we have are mostly ages 30 to 50. 30 to 50. So, got another question. So I heard they think it will die out with the heart. Oh, with the heat. Is that true?
They are hoping, and the reason they hope that is that there are other coronaviruses out there that cause colds, and you know there are other coronaviruses, not just this one, and
Right.
they all have seemed to die out with the heat. This one is susceptible to heat, but we don't know if it's going to die out.
We can't
We
really
just
bank
hope.
on that and guarantee that.
Yeah.
Okay. And for those that don't know, the president came out earlier today and said that the what are they even calling this? The stay in and live, or stay out and alive. I don't even know what it's called. It's got some kind of little ringtone to it. Let me see if I can find it. But anyway, the president said we're gonna be doing this until at least April the 30th. Whereas before he was like, oh yeah, we're gonna be back in church Easter Sunday. I'm like, I hope you're right, Mr. President. I sure hope you're right. But you and I have been talking, and we both did think that was going to be. We thought that was very ambitious, you know,
Right. Right.
and I was hoping he would be right, because I mean, who wants to sit around and Lord knows I'm getting cabin fever, and I go out every day, and I'm still working.
Yeah.
I'm getting cabin fever, so I mean, um, see if we got any. All right, so we got some reports. Christina says all the box meals in my Kroger are gone. Yeah, I think you're gonna start seeing that. Thank goodness I live in Vegas. Wednesday I went to Kroger. Let's see here. Okay, so we got a curfew in Bryan and College Station starts at 9 p.m., not 12. So down there in southern Texas, they're doing curfews even much earlier than you guys are there in Tyler.
Right. Right. That's good.
Let me see here. Jennifer said that would be social distancing guidelines. Okay, thank you, Jennifer. It's called social distancing guidelines have been extended until April 30th. And correct me if I'm wrong. We still in March right now. We haven't gotten to April yet. and the
Right.
president of the United States is already extending this out. So, what does that as a medical professional, Ferell? What does that tell you when the federal government says, "Hey, we were hoping this, but we are extending this," and I think this is the first extension from the social guidelines. I think.
Right.
Okay. So, what does that tell you as a medical professional?
That they're starting to realize what they're dealing with. In the medical field, I talk with doctors. I have a couple of friends that work at at the CDC. I have a couple of friends that work in other hospitals around the country. Everyone's saying the same thing, that this is serious. This is a game changer. Um, a lot of the doctors that I've talked to feel like this is going to be even once we get a vaccine, this is going to be something just like the flu, in which we'll have to be vaccinated every season. Let's say we have a COVID-9 season. Let's say if it does die down during the summer, then it's going to come back in the winter. We're going to be vaccinated every time. Now,
I
just
heard that
imagine
too.
that.
Yeah, I've heard that too.
Just imagine, this is this is a virus that we're going to be forced to live with and integrate it into our lives, but it also mutates at an astonishing rate. We don't know what to expect. We have no idea what the winter is going to look like. We have no idea what next summer is going to look like. We don't know how many times it's already mutated twice in 6 months.
Yeah.
So we don't know what 2021 is going to look like. That's why we have to, do our best to stay ahead of this thing as much as we can.
All right, so I'm gonna read a couple of these comments. Linda says there was not any spaghetti pasta, spaghetti sauce, canned food, salad dressing, paler products, but plenty of fresh fruits and veggies was there, or 4 times worse than a hurricane. My man Kevin says, I mean, no disrespect, but if the president had any brains, he would have done order a full financial halt, no charge for anything, and National Guard food delivery economics should not matter now. And then let's see here. Tara says our Ingles had most stuff in on stock today. So I'm gonna tell you guys now. I keep reporting here in Virginia. It's not bad like it's been in other places of the country. We ran to the grocery store today. We was able to run in, run out, get what we needed, and get out of there. And people were just, I mean, around here, it's been like business as usual. We haven't had a huge outbreak. We did have a cluster of about 15, 20 folks about 45 miles from me. And that's like more of a rural country area. I wasn't even expecting that. And we had our first death right here in Virginia Beach last week, which was an elderly person. Um, but it seems like it's hitting certain pockets of the United States, and what it seemed like to me were where most of the people came in early before we started all this social guidelines. Um, I'm trying to catch up on some chat here. We do have one person in our group. She wasn't feeling well. She's had a fever for like 7-8 days, and she says she's still coughing but no fever. So that's good to hear. Good to hear, Tara. So
Sorry
Ferell,
about
if this thing, and I know we talk doom and gloom all the time. So listen, guys, I'm gonna preface this question and these statements by saying this is not what we want to see at all. And I know Ferell sounds like, because you got to understand he's in the medical profession, and this is what he does. I mean, when SARS came out, he was calling me talking about SARS and everything. Man, this thing, blah blah blah. So this is the way we talk all the time about these viruses, diseases, and things like that. So do not think that we are trying to praise this. Don't think we trying to. We hope for this. We do not want this thing to continue, right, Ferell?
No, we don't.
So in saying all that, worst case scenario, let's take us through the next 6 months. Let's say that the summer doesn't slow it down, doesn't kill it off. Worst case scenario in the medical field over the next 6 months, what can happen?
Man. Whoa, man, you put me on the spot.
Well, you knew I was going to
Honestly,
do that. You know I had to turn up the heat.
yeah. Honestly, if this isn't slowed down, uh, if we can't get a handle on testing, which that's the key to it, knowing where the infected are and being able to mitigate, isolate them, make sure that they're not infecting any more people. If that doesn't happen, if it keeps accelerating like it is,
Right.
it will overrun our system, our healthcare system. Healthcare workers are already getting sick. They're going to continue to get sick at massive rates because we just don't have enough PPE or personal protective equipment out there. I've had personally, I've had the same N 96 mask, N95 mask for um, a week and a half now. We have some on back order, but we haven't been able to get any more. Um, if we're not able to stop it, then it's going to be the bubonic plague of our generation.
Wow.
Where it will be, and it's inevitable if we don't get ahead of it. I'm talking, millions and hundreds of millions of deaths, and
You talking
it's
about
already on
worldwide?
track worldwide.
Okay.
Worldwide.
So what is the key to us getting? I mean, even with because this is just me thinking. This, as my granddaddy said you used to say, this is just good horse sense. Even though we're practicing all this social distancing stuff, and even though the numbers are still going up, what happens the moment that the president, the governors, the mayors of cities say, okay, go back to business as usual? Even if we've done all this testing and we know what the pockets are, isn't that a risk and a chance of us just blowing this thing up? Even if let's say the numbers start going in, what they say, balancing the curve, or what is it with
Right.
the curve? What they call it? Knocking
Flatten
off
the
the curve,
curve.
flatten the curve. That's it, flatten the curve. So even if we flatten the curve, and then we release release the social distancing area, and we all go back to business as usual, is that not going to spike the numbers up again?
Common sense says it would, and I don't see what would stop it because the only thing that's going to slow this virus down, um, I mean, really slow it down, is social distancing, and the other thing that's going to bring it to a crawl is the vaccine. We all know, and we've heard over and over again, the vaccine's not going to be here. We're going to be lucky if it's here within 18 months.
Right.
Now, so me personally, I can't see going back to business as usual. Schools back in session,
Right.
uh, restaurants back opening. I can't see going back to the life we knew before this vaccine is out. I can't. I can't honestly see how a rational person can come to that conclusion. How that's going to be any better? That's just my personal view. Um, it just can't happen until a vaccine comes out.
Okay. I mean, cause it just doesn't make sense to me that okay, the only way I can see now, if China is telling us the truth and they shut the whole country down for 2-3 weeks or whatever, if we were to do that right now and nobody comes out, and then the virus just, unfortunately, I mean, I hate to put it this way, it just dies with the people who have it, or we sit in the incubation period long enough where, okay, well, 14, 21 days, everybody's been in the house and nobody's had any contact with anybody. Short of that, like you're saying, I mean, we're gonna be doing this for the next 12, 18 months. It seems like.
Yeah. Now, there is I know we're talking a lot of
You
doom and
know.
gloom, but there is a new test coming out supposedly by the end of this month, by March 30th.
Okay.
It's just like with the flu. With the flu, we have a point of care test where we're able to swab and get the results back in 15 to 20 minutes. They're saying the government is saying that they have developed this and that it is workable. Now that is a game changer. If we're able to do our social distancing and able to flatten the curve, as they say, and we have this 15-minute test where we can accurately find out if you have it, if it's affordable, where we can mass distribute it.
Right.
That's gonna be the problem. Mass distributing it, getting it out to everybody that needs it. We can get a handle on it, and we'll be able to. I think we'll be able to go back to some sort of almost normal lives.
Almost normalcy. Yeah. We got a question. Where are all the millions of masks that they supposedly been sent out to the hospitals?
That's a good question. I got
Ferrell's,
one.
Ferrell's looking for his mask. He's like, I got one, and I had the same mask for the last week. And then
That's a
one
good.
of one of our viewers' name is Kev H. He been saying this for the last 3 weeks. He's been calling this test gate for the last 3 weeks. So I guess he is absolutely right. This is test gate 2020, because every time we talk to somebody, it's always about testing, testing, testing. Um, But you know what? You've kind of cleared some things up for me tonight as far as testing and finding out where people are. Because if you can get those folks to quarantine who have it, even though people may have it and don't know it, but the ones that do have it, you keep them in quarantine. This we could kind of slow this thing down. I can see that. Let's see here. We got a question from Monica Smith. Ferrell, with you being in the healthcare industry, when a vaccine is finally available, will you be fully confident in the research and development supporting it, considering the tight time frame to get? Hold on, let me get to get it out on the streets. Good question. Wow.
And there's a lot of there's a lot of people that are scared of these vaccines that are being put out. You know, a lot of people say, "Oh, I'm not taking a flu vaccine. That gets me sick." If a vaccine comes out, I'm gonna be the first in line for it. I'm just gonna tell you. If it
Okay.
comes out, I'm gonna be the first in line for it. The probability of it helping more, it just outweighs the probability of it going bad. Can it go bad? Yes, it could be bad. Getting the virus, I know it's gonna be bad.
Okay.
I know it's
uh,
gonna be bad.
all
So
right, we got.
I,
I'm sorry. Go ahead.
I just rather um, take my chances with the vaccine than to take my chances just
Without it.
going out there next.
Okay. All right. So Ashley says, my mother's a nurse. She said that they only have 40 N95 masks available where she works. That's incredible. And she's a nurse. What happened? Did I knock myself off? Uh-oh. By himself. Okay. Bro, what happened? You still there? Hello? Uh-oh. Can you hear Farrell, baby?
I hear you.
Oh, you can
I
hear me?
just can't
Okay.
see you. I can't see you though.
I don't know what the heck happened. Uh-oh. Well, my camera just went out. But there it is. It's like okay. I guess the cord ran across the thing and knocked my camera off. I'm back. I'm back. All right. Should we start making leather face masks moving forward? Oh goodness.
I
Uh,
don't know.
all right. So I got a question. It says, do you guys treat people who aren't severe? Okay. Good question.
Do we treat people with COVID-19 that are severe?
Uh,
Uh,
that's what I'm assuming. He just said treat people, but yeah, if you got people to come in, I mean, because matter of fact, we talked about the symptoms, but what are the symptoms for the COVID-19?
right now, currently the symptoms are shortness of breath, dry, non-productive cough, and a fever. Uh, Also, you can put in there fatigue. Um, but those are the current symptoms. We also have been seeing some secondary symptoms in people. They've been put out that you'll lose a sense of smell and a sense of taste. That's recently come out in the last week.
Okay.
And also, I think before, uh, diarrhea has recently come out. Those new developments in those symptoms are indicative of a virus that is preparing to mutate.
Okay.
So that's what's got us concerned. That's indicative. When the symptoms start changing, then this thing is eating its Wheaties. It's
Right.
getting stronger.
Wow. Well, man,
And
you've
so,
been okay. I'm sorry. Go ahead. Go ahead.
oh, that's what I was gonna say. And currently, if you have those symptoms, they're gonna send you home and self isolate. They're not gonna take you to the hospital. The only time they're gonna admit you in the hospital if those symptoms become life threatening. That's just
Okay.
the way it is. It's more dangerous for you to be in the hospital infecting other people than it is to be home and self isolating.
Okay. So let's say that somebody does get it and they have a family. When they say isolate and quarantine at home, it's kind of hard to be by yourself and quarantine yourself when you got a family at home. So what do y'all recommending people do? Because like with the first case that you saw came in, he ended up infecting his whole family, didn't he?
We don't know yet, but we did. check his child who was 18 months and showing symptoms.
Okay.
And I wasn't privy to those results. I don't know if
Right.
it was positive or not. I
Okay.
pray it was. But this is one thing I think it's getting lost, and I haven't heard it out. I heard a couple people say it, but I truly believe every family right now, if you live in I live by myself, so I'm good. But every family should sit down and have a talk about how are we going to act if one of us comes down with this? How are we going get you an isolation plan? This is going to be your bathroom. This is going to be your side of the house. You're
Right.
only going to go in these areas. Get you a plan together. You don't have to, be in the medical field to know how to separate yourself and make sure your surfaces are clean before you cross to infect the rest of your family. Get a plan before somebody gets sick. Sit down and talk about it. It really would behoove you to get that plan together prior to somebody getting sick, because the way things are going, everybody eventually is gonna know somebody who has it.
Okay. Good advice. So I know we've heard, wash your hands constantly, don't touch your face. A lot of things that we should have been doing anyway. What are some other things that Dr. Fauci and the government and even you and your background, what are some other things that we can do to help prevent us from getting it?
Just like you said, common sense things. Um, Hand washing, number one, number one, number one. And in absence of hand washing, if you're not able to wash your hands, use the sanitizer. But hand washing is 100 times better than sanitizer. Trust me.
Right.
You know, uh, after and be mindful of what you're touching. Be mindful of who's touched it before you, and be mindful. Now, this thing is not going through the skin. If I
Hmm.
shake hands with Roderick and he's infected, it's not going through my skin. The only way I'm going to get infected is if I touch my face, around my mouth, my nose, or my eyes. Anywhere that you have uh, mucus lining, you know, uh, then that's the way the infection is getting in. Just casual contact with physical contact is not giving it to you, but it is putting it on your hands, and therefore you put it in your face. Now it is you're able to inhale this. So that's where we go to the social distancing, because someone who has it, and I'm not talking about normal breathing. I can't breathe on you. They haven't found any cases where I just breathe on you and get it. I'm talking
Okay.
about a cough or a sneeze. Something that puts droplets in the air,
Right.
and then I inhale that, or that cough or sneeze goes on a hard surface. I touch that hard surface and then go and put it in my face. That's how we're thinking is transmitted.
Okay. Now I also heard Dr. Fauci. This morning I was watching an interview with he and Trevor Noah, and he was talking about the surfaces. It can last on surfaces they know for 3 hours, but he also said that things like your packages coming from Amazon, and he's like you don't really be worried too much about that. How do you feel about that? Would you treat that? Would you? Because I treat all our packages like they got the corona already. I'm disinfecting, wiping them down, spraying them with Lysol and everything. So, um, how do you feel about that, and what would you recommend?
Yeah, soft surfaces such as cardboard, paper, packages. You're looking at 2 to 3 hours.
Okay.
Now, hard surfaces. Now they have seen studies, and I'll confirm this by talking to doctors because it just amazed me. Up to 3 days on hard surfaces such as metal or plastic. They found
But how
traces.
how is that possible? Because we've been taught all our lives that viruses cannot live outside of our host. How is that possible?
Um, because we've discovered that viruses really aren't alive. Okay, they're
Okay.
just RNA material. They're strands of DNA sequences that are just sitting there. Now they have a protein coat that protects them.
Okay.
As that protein coat breaks down, if it breaks down, then the RNA sequences, the DNA sequences, it starts to break down. But there are different protein coats on different viruses. Now, COVID-19 has a protein coat that's pretty resilient. In absence of extreme cold and heat, it can stay on surfaces for up to 3 days. They did find traces. I don't know if you remember the princess,
Yep, the Royal
17
Princess.
days, but they went through there and swabbed and found traces of COVID-19. This is DNA, the RNA material of that still on there.
For up to
Now, if that was
17
able,
days.
they don't know if that was able to infect you, but they
Right.
found traces of it. I wouldn't
Wow.
take that chance,
Right.
you
Right.
know.
All right, so folks, make sure wash your hands and sing the happy birthday to yourself 3 times and sing your alphabet and scrub under your nails and all that good stuff. Have your hand sanitizer with you all the time if you can find it. If you can't find it, then you make you some. Um, and what else? I mean, just and really practice social distancing because you don't know who has it. Kev H had a real good point. He said if you contract it and can spread it before you have symptoms. It doesn't matter if you quarantine from household family members because chances are they already have it without symptoms. I mean, common sense will tell you that. If I'm infected, more than likely Jumper's gonna be infected too. I mean, because we up on each other all the darn time. And what about your pets? Because we had heard a story early on that there was a dog tested in China from somebody who was positive, and the dog had traces of it. Um, we don't know if they had licked the person or whatever, but can they be transferred from humans to pets and then vice versa?
No. Now they did find that in China there was a dog that his owner tested positive. Then the dog tested positive. They believe that the dog just licked him, so the dog had trace
Okay,
COVID-19 material in his mouth, but they don't believe that it was enough to transmit it. Again, they don't know,
right,
but typically once a novel virus makes that transition from an animal to a human,
right.
the DNA sequencing changes. It can't live in an animal anymore.
Ah, okay,
The human is the host now, not the animal
gotcha.
anymore.
Okay, wow. Well, I think you've given us enough to chew on. And man, you know what? I knew you would do a good interview because you always do. But man, you're so knowledgeable about this stuff. But I know this is your wheelhouse because you be calling me talking about, man, we got this new thing, and blah, blah, blah. And I'm like, Ferrell, ain't nobody even heard of that. What are you talking about? So, we do this probably 2 or 3 times a year where we talk about viruses and pathogens and all that kind of stuff and new stuff that's out that doesn't blow up. But this one right here, unfortunately, has blown up. And in your opinion, moving forward, do you think that this is going to help change our medical treatment in the United States for the better or for the worse? Do you think we're going to be more prepared in the future? Or do you think we'll, because I mean, this thing smacked us between the eye. Nobody was expecting this, and obviously nobody was ready. What do you think is going to happen in the future with our medical um, treatment in this country?
Um, I further believe uh, that it's going to make it so much better.
Okay.
I really do. If I'm wrong, then we're not the country we say we are. You know, I believe the American people are resilient, resourceful. I believe we are the best. We're always an overcoming country. We overcome, and this we're gonna lead the world in this thing.
Okay.
Once we get through it, but we just got to get through it. We really do. So people have to realize that this is something that changes your life. Just like you know when you're married, you have a husband and wife. They are able to do it things, able to go out, do all these things. Once you have a baby, your life changes forever.
That's
Even when
true.
that child is grown, your life changes forever.
Yeah.
America, the world has changed forever. It's not going to be the same.
Okay.
So we just have to accept that, and the sooner we accept that, then we can start getting control of it.
Okay. Got a question. What's the recommendation on traveling by car? And I'm assuming they're talking about traveling maybe multiple states. So what's the recommendation with that? I know you probably need to make sure you have some gloves so when you pump gas, you can put a glove on and pump the gas and then take the glove, throw it in the trash. And that would be one of my recommendations. Keep some hand sanitizer with you. If you're gonna stop and use the bathroom, you probably want to disinfect everything before you touch it. And if you're at a truck stop, you definitely don't want to use the bathroom. But what are some of the things that you would reckon if somebody was traveling? I mean, I know I'm not going to travel right now. I know that for a fact. I'm not going anywhere.
Don't do it unless
Okay.
it's absolutely necessary. And I really can't think of a reason that you would need to. Um, I know we have loved ones and that have issues, maybe sick, or that's the only thing I can think somebody would would possibly think about going and traveling to see them. But just trust and believe, you're probably going to put them in more danger.
Right. I mean,
So
right now, think about it, folks. Right now, we have become accustomed of not assembling more than 10 of us together. Think about that. Right now, think about this. In the United States of America, the most free country in the world, we are restricting ourselves from eating at restaurants, from going to theme parks, going to church. Think about it, folks. We're in the middle of slap dab of in a pandemic that we're not even complaining that we're not doing those things. We are going along with it, trying to help do our part in not spreading the disease. So I think right now it's traveling at your own risk, to be honest with you. And
yeah,
then again, I think about this: if I'm thinking about traveling and I'm going away from my home somewhere else, there's a chance that when I leave, I can't get back home because so many and one of our counties did it out here in North Carolina about 3 weeks ago. They shut the whole county down. They like if your ID card does not say an address in this county, you can't come in. So that's one of my concerns right there. If I was going to leave, would I be able to get back home, or would I even be able to get to my destination? Because right now I can't remember where it was, but they were stopping people who had New York plates. They were stopping them. Because a
that was
lot of
in New
folks,
Jersey.
okay, New Jersey. So a lot of folks are trying to leave New York and they have out of state plates and they're getting into another state and they're stopping them. So, I mean, I don't think traveling
This
right
is
now is the best thing.
I try to look at it, the silver lining, and this is just my personal opinion. You know, at any time in our society, was there a good time for to happen? Would be now. Just think about, Roger, because this had happened back when we were in high school or in middle school in the 80s and 90s. We didn't have
We
the
wouldn't have had
way.
any information. For one, that would have been a lack of information. That's number one. And then we would have gone crazy because now, I mean, back in the 80s, 90s when we was coming up, man, it cost you 25 cents to call somebody long distance a minute.
Right. We couldn't
Now
talk. We couldn't
we
communicate
can
like
do this. Yeah, I think you're right. This
churches
is the
wouldn't
best
use.
time. Go
Yeah,
ahead, man. I know I
we're
interrupted you.
able
Go
to
ahead.
communicate. That's all right. We're able to communicate with each other a lot better over distances. I can call you and look at you and see that you're okay. I don't have to go to
Right.
see you. I went to 3 different church services this Sunday. I've been to more church services online than I did when it was here.
When you could
Everyone's
go
like,
to
"Come
church.
see my service. Come see my service." And I was blessed by it.
Right.
We're able. You know, this thing is bad, but we're prepared for it. We're able to. How many people can work from home?
Right.
You couldn't work from home back in the 80s and 90s.
That's true.
Rarely.
Yeah.
So we're in a good position to really stand up to this thing. We just have to be diligent and be mindful about what we're doing.
All right. So I'm gonna answer this guy's question. He's like, serious question. Do I need to make cow face mask to protect my family? I think that you should do anything that you feel like you need to do to protect your family right now, because this thing is
Right.
serious. I mean, think about it. Even going into the grocery store, you're risking getting the virus and potentially getting sick, very sick. I don't believe that the coronavirus is a death sentence. For most, because you got a 96+% cure rate. I mean, fight and live rate. I don't think it's a death sentence, but just think about the people around you. You know, the more you go out, the more you're at risk. The more you're at risk, the more you're susceptible, and you might not even like me. I know if I get it, I know I'm gonna be perfectly fine. But my biggest concern is coming home and giving it to Jennifer. You know,
Right.
because you just don't know, and and I think that's the most aggravating thing about this is that we just don't know. And
No, and
even
that's why I
even
haven't.
Go ahead, man. Go
Oh,
ahead.
go ahead. That's why I haven't seen my grandparents face to face in 3 weeks because I know
Right.
this thing.
And you live
They
down the
didn't.
street from them. You live down
I
the
live
street.
down the street.
You could walk to their
Down
house,
the street.
both of your parents, grandparents' house. You could walk there in 3 minutes.
Yeah, so it's that serious, you
Right.
know. And the thing is, this virus could possibly wipe out
Yeah.
a whole generation of knowledge, a whole
Right.
generation of experiences. You know, sick. It really could, and that's what we want to keep it from happening.
Right. Got a question here. What if it reinfects you? Would symptoms get worse or compound? If you get
Good
it, get over
question.
it. Yeah. If you get it, get over it, and then you get reinfected.
Good question. Um, There haven't been any cases of somebody being reinfected, but the medical community thinks it's possible. Just like you can catch the flu, one season, your immune system next season can catch it again. You can catch it again. Uh, are your symptoms worse or better? Sometimes it's worse. Sometimes it's better. We just don't know, and that's the hard thing about this virus. We just don't know what it's going to do.
Now explain stuff. Like, I keep hearing this herd antibody, or as we group together and more people get it, we'll start developing some kind of immunity or herd. They keep talking about this herd immune. Explain that to me.
But it sounds more complex than it is. That's just everybody getting vaccinated constantly. The majority of people gets vaccinated. The virus has nowhere to go,
Okay.
and therefore it's less effective.
Okay.
But they're talking about vaccination. They're not talking
Ah.
about we group together.
Okay. Cool. All right. Well, brother. We've gone about an hour and 15 minutes. I know you was here early, so I appreciate you being early. And I try to keep, when I do my interview shows, I try to keep them at an hour. And I know it's getting late where you are. You probably want to get you something to eat and get ready because you get started way earlier than I do, way
Yes, sir.
way earlier. So man, I appreciate you being on with me tonight. And I know you had a good time because this is your wheelhouse. This boy, you should be standing when when I see Dr. Fasci on TV, I say my boy should be standing right there with him as the Attorney General because you you the person I go to when I be like, hey man, have you heard about such and such? So you be like, oh yeah, let's do that, let's do this. It gets complicated and got this the DNA, the RCA, and blah, man, you be on it. So I knew you would be a wealth of information, and I appreciate you being here tonight. Let me see. You have any information about building your immune system so we can adapt to this? Okay, that's a good question.
Um, yeah, just the normal things that you do to build your immune system. Your immune system can attack this virus, and it does. It's just so voracious in what it does that vitamin C, um, zinc. People say zinc shortens colds. They come out with what is that zinc? Uh, I forgot. There are a lot of supplements out there that have zinc in them. They found
Okay.
that shorten viral infections. Zinc is really good. You can't overdose on it. It's a mineral. So zinc, vitamin C, hydrate, hydrate, hydrate. Um,
Water, water, water.
just yeah, and just and you'll keep a strong immune system.
Yeah. Let me see here. Knife says I have access to some N95 surgical masks that may be 4 to 5 years old. The rubber straps are still in good condition. I presume these are still good. I would assume they still be good. I mean, they've never been used,
Yes.
and as long as they're not dry rotted or anything like that, they should be good.
Mm.
Yeah, that was a great question, Kev. All right, guys. Thank y'all so much for being here, Farrell. Thank you so much, brother. I'm gonna let you off the hook. And
All right, bro.
next time I'm not gonna be so nice. But since this was such a serious conversation, I didn't want to mess with you too much tonight.
I appreciate it. I appreciate it.
All right, man, you good?
Yeah. Stay
Uh,
safe.
yeah, tell it. Oh, we got one person said, what about elderberry? Elderberry is always good to take. So
Yep.
yeah,
Elderberry is good.
yeah, yeah, and get plenty of sunlight, y'all. Because your body's gonna build natural vitamin D by being out in the sun. So make sure you get some sun. Just because you're in the house doesn't mean you can't go outside and run in place, do some jumping jacks, walk around the neighborhood. Even if you got to do
Yeah.
it, on the other side of the street from somebody. You don't have to. You don't just because we're social distancing does not mean stop working out, stop living your life. It just means stay away from other folks, which is hard for us because
Right.
we love it, done. We're like, hey man, give me a hug, blah 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 blah. You know, that's kind of awkward. Now, I had a guy walking to me today trying to shake my hand. I was like, no. So just keep your distance, wash your hands, and this too shall pass. I know we talked a bunch about doom and gloom tonight, but this will pass. We will overcome this. We are more than conquerors, and we will get through this together. And even if it takes 18 months, and remember this, we've been social distancing now for like 2 weeks, 2.5 weeks. After 21 days, baby, it's a habit. So this is the new norm. And every night, I wanted to put this out before we got off. Every night, we are going to be doing a live, some kind of live. It may only be 30 minutes. I know y'all used to hour long, 2 hour long lives with me, but every night at 8 o'clock, I'm planning on coming in, doing a live, checking on the family, seeing how you guys doing, give y'all some updates, and then just chatting. We won't be always doing interviews like this, but I felt the last 2 nights, just to calm everybody down because folks were emailing me and texting me like, man, I'm just getting so nervous about this thing. Oh my God. So I thought it would be good for me to bring some healthcare professionals in to talk to everybody to kind of calm everybody down. We still know the severity of the situation, but calm down. Ferell, I'm gonna let you have a closing remarks, and then we're gonna end, brother.
Well, just understand that we will get through it. Remember your social distancing. Remember your hand washing. Remember not touching your face. This is going to be with us for a while, so let's just settle in and let's start teaching the younger generation. We got to pass it on, teaching the younger generation.
All right, brother. All right, man. I love you. I'll holler at you later.
All right, peace, man.
Take care. All right, family. Love y'all. I send y'all some love, and we will see y'all on the next one. Definitely tomorrow night at 8 p.m. Eastern, 7 Central. Is it possible that this was out in, okay, is it possible this was out in June, July 2019? Anything is possible. It's hard not to touch your face. It's always hard not to touch your face, Paul and Adrian. Um, Brashante, to answer your question, yeah, it's possible it was out in June, July. It was very possible it was running rampant in China, and they didn't let us know until uh, November, December time frame. So yeah, it's always possible. So anyway, guys, we will see you guys later. I'll probably do a live in the morning, and then we're gonna be back tomorrow evening at 8 p.m. Okay, y'all be good, be blessed.